All right, joined now by Dr. Fadale, University Orthopedics. We got them all set up on the Zoom call here. What are you guys doing at University Orthopedics in the pandemic that we're in? Are you still operating and working on patients?
So we are walking a very thin line, and one of the lines are, hey, everybody around the country's got to shut it down. And so we are good citizens. We've gone down that road. But on the other side of the equation, we're orthopedic surgeons. People hurt, and some of them are hurting very badly. So we can't totally shut it down. So we're trying to be very respectful, and we're seeing obviously much less patient volume, but we are definitely still seeing patients. And the health department wants us to operate at some level, a low level, but people are really hurting, need health care. And so our staff is bravely coming in, and we're still seeing patients every day.
Are the appointments that were scheduled months ago, are you guys honoring those dates and not taking new ones? Or how are you navigating, hey, I'm supposed to have knee surgery April 20th, I scheduled it 6 months ago. You're still honoring those, whereas if someone gets hurt yesterday, are you getting them in now, or how's the scheduling working?
Difficult, because we are then on the front line to determine who's more important and whose pain is more important than somebody else's pain. And it has not been easy. I can tell you we're not grinding through any of the equipment that's required to fight this battle. We've been very careful to not push through equipment where, for example, general anesthesia, none of that's happening here. And we told all the patients, hey, there's a pandemic. We'd like to cancel you. So we clearly have cancellation lists. You can imagine that doesn't always go so well. There are people who want to work, who have to work. The guy who's on a nuclear sub, who's got to get back to the nuclear sub, and he can't wait 3 or 4 months.
Right.
I had a nurse who works in an ICU. He says, well, what do you mean I'm going to wait? I got to get back to the battle. So we are on this front line of navigating to some degree who's more important. And in orthopedics, you can't just shut it completely down.
So you and I usually talk about high school, college, professional athletes. Obviously, those games aren't being played, so you're not getting someone who's coming off a field and coming right to you for surgery. But how, in that world, how are you seeing people who need surgeries from a nagging injury or something that maybe happened recently? How are you guys dealing with those? Because when Chris Sale got Tommy John surgery, the Red Sox pitcher, and I kept reporting on it, people were getting mad at me because they're saying, why does he get to have surgery and I don't, or what have you? So how is the sports world dealing with this?
Poorly. It is very difficult for physicians to determine who is more important than whom. So either we shut all of it down, but in the world of orthopedics, people hurt pretty bad. They can't function. So you can't just shut it all down. But I clearly understand from your viewers, what's up with that? This guy's worth $150 million. How does he get to jump the line? And I also am somewhat concerned about that there's two different standards we're doing here. And so I don't know what the answer is philosophically, but I clearly appreciate your viewers getting mad because they're getting pushed off.
Let me ask you about Sale, because I just brought him up. He's had elbow pain since August, sort of dealt with it, didn't have the surgery. He was going to try to battle through it. And then ultimately he was going to still pitch until the Red Sox, with the season postponed, I think decided, hey, we might as well put this guy under the knife. In your estimation, been doing this for a long time, did they botch this whole thing? I mean, you don't know the case specifically. You haven't seen his elbow, but everyone's saying, why didn't he just have the surgery last August? And now his 2020 is gone and a portion of his 2021 could be in jeopardy.
Yeah, this gets ugly because you don't know how this plays into contracts, how he's going to plan it out that, hey, I'm going to miss a season, and then the next season I got to bounce or bump in my money. There are all sorts of financial choices that are made that you and I don't know about, and the average fan will never know about. That it's not just about the medical treatment of these athletes, but it's about their career, their contracts, playing for angles and where they want to take it. So on the inside line, hey, maybe I can get another year out and then maybe I'll play it another way. And when it became obvious, what a great year to have surgery. Okay, I'm out. Let's get it done. It doesn't make a lot of sense. It looks like it was botched.
Yeah.
But there might be on the financial side a reason we don't get.
And how all these athletes who are training on their own now and not with their strength and conditioning and their doctors for these teams, do you think how nervous are these organizations probably? And are these athletes in jeopardy? I mean, they're professionals, they know how to train, but of getting hurt. And I guess with everyone being on their own, do you think, having worked with colleges and such, that teams are going to be worried about their own guys getting hurt and not being under proper care?
How smart is that? Of course they are. So I'm sure you're very knowledgeable that when pros sign contracts, in those contracts will determine what they can and can't do in their free time. So
Mm-hmm.
the NBA guy can't just go down to New York City and pick up a game in the hood. That
Right.
just cannot happen.
Mm-hmm.
And so if you get on a motorcycle or do something like that, your contract is null and void. And I think someone for the Atlanta Falcons many, many years ago was on a motorcycle accident. And sure enough, the team initially said, we're not paying this contract anymore. So the teams are very nervous because they have nobody around them to guide them through this. And so they're going to play ball or they're going to do strength and conditioning on their own. If there's an injury, there's an injury. It is what it is. So yeah, the teams are very worried.
Let me ask you something. Tom Brady has always been generally healthy. Will it be any different for him dealing with a new medical staff, new doctors and trainers with the Tampa Bay Bucks?
I think it'll be a little bit different. He has his personal trainer. He's got his personal therapist or whatever, if you will. So he'll have a transition phase in there. And because of who he is, I don't really think any physician or therapist is going to come up and tell Tom how it's going to go. I think it's going to be a group vote. So I'm a little less worried about him. He has a whole medical empire behind
Yeah.
him. It's kind of come with him.
Do you have any personal stories, or having worked with Brown over the years, of knowing athletes are such creatures of habit, not having the games, the practices, losing entire seasons? On a personal level, how much do you feel for these athletes right now not getting out there to play?
So you can imagine for all of us who just exercise once in a while, we're all terminally depressed. For the person who goes out and can't go for a run or go bowling or whatever they do, go to the gym. The internet is filling up with people who are in meltdown. Now you multiply that by 100 to an athlete who is driven and lives on endorphins. Oh my God, is that hard? And let's go up one more level. How about the Olympians who spent 4 years for maybe a 10-second run or something like that, and it got wiped out? I think the athletes are really struggling badly mentally, as a lot of people are around the country being cooped up. So I feel terrible for these people. Problem is, there's not a clear let's get going sign anywhere near in sight.
All right. Good stuff, Dr. Paul Fadale. Thank you for joining us, keeping us up to date on what's going on in your world amidst this pandemic. Thanks so much for joining us.
Thanks, and wash those hands.
All right. Let me stop this recording before I...
Listen up, Yianni.